fairly new to Stark County. I've been here about a year. Hang on a second. Brian, that's like,
What's the matter with it?
oh, okay, that's good. All right, I'm going to talk to you about a really exciting topic tonight, and that's certification standards for providers. I'm not going to have color wheels, and we're not going to have fun stories to talk about, because this is basically review of standards that providers have to maintain and keep up in order to continue to be certified as waiver providers. And we are only going to talk about waiver, home and community-based waiver service standards and certification. All right. First of all, any provider, anyone receiving, can I not use this? Do I have to use it this time?
I'm afraid they won't be able to hear you back here.
Can you hear me back there now? Because I keep getting whiny feedback.
So maybe step that way a little bit more.
How's it sound now? Oh, that's better. Okay. First of all, any individual enrolled in a waiver who receives services, regardless of what kind of service it is, whether it's home or personal care, which is help with daily living skills in their home and community access, or adult day service, or transportation to and from their day program, or employment, the providers who help the individual with these services must be certified by the Department of Developmental Disabilities in Ohio. So that's the kind of certification standards we're going to talk about. Basically, the numbers are pretty much like this in terms of numbers of providers. Across the state, there are approximately 8,000 total providers to deliver services in all the 88 counties for all the different services that are listed under the waiver programs. There are two different kinds of providers. One is an agency that employs staff to deliver the services, and the other is independent or an individual provider, where an individual gets their own certification, not individual services. A person can become a certified provider on their own. They're their own business. They work directly with the individual, and they follow the services in the ISP themselves. They don't work for anybody else. They're an independent contractor. All right, out of these two types of services, there's 111 currently working in Stark County. When I say that, that means delivering services right now. And 111 agencies and 133 independent providers. So you can see there's more individual independent providers than there are agencies. Now, if you're familiar with some of the providers out there and even some of the agencies, it probably doesn't seem like we have 111. Well, we have 111 who have been assigned in an ISP and who have been paid for services over the last fiscal year. We collected this data starting July 1st of 2014 through June 30th of this year. So for that previous fiscal year, these are the numbers. They're probably a little bit different now for independents and even agencies, because we get requests every month from new agencies wanting to deliver services here. And the same thing for independent providers. Here's what it looks like on a graph, and it shows you the progression and growth of our providers who have delivered services here in Stark County, comparing both independent providers, which are the individuals on the blue line, and the agency providers, which is the red line. We started collecting this data in 2009 and 2015. You can see there's kind of a steady gradual growth. That's what we want to see, so that we will be able to have providers to meet the capacity of need, meaning how many individuals out there who are enrolled in waivers or going to be enrolled in waivers. We need the providers to be able to deliver the services, and we need a large selection because we're such a large county. By the numbers, individuals served. These are the people enrolled on the waivers, your family members. Independent providers, people served by independents are on the blue line, people served by agencies other than Stark County Board, and then Stark County Board is the yellow line. As you can see, Stark County Board's starting to drop down a little bit. As we move further through the consolidation, that'll continue to drop, and the other lines will continue to grow. Independent providers, chief executive officers, or the directors of agencies, direct service employees of agency providers are all required to become certified to deliver any kind of waiver service to an individual. The Ohio Department of DODD, Ohio Department of Developmental Disabilities, maintains all the responsibility and authority for this certification process. It's all done by the State Department in Columbus. They maintain the responsibility for issuing certification. They maintain responsibility for the overall compliance, and that's the review of providers to ensure they're maintaining their certification. They set the certification standards. DODD writes the rules, which providers have to abide by, and we have to implement. They write the rules for us in SSA, and any other service that's delivered and authorized in the state of Ohio for individuals with developmental disabilities. They hold the authority over all provider certification and compliance, as I said. We at the local level, we may assist with a provider compliance review. We may provide the state or another entity that's certified to do compliance audits. Compliance reviews are audits of providers. But right now, we don't maintain any of the authority to hand down any kind of repercussions following an audit. Once certified, independent agency providers connect with their local county boards if they wish to work in. This little piece is kind of a new requirement. The rule that defines provider certification was just updated on October 1st of this year. It's been in effect for many, many years. In 2009 it was updated, and then it was updated again this year. All of what we are reviewing is obviously what's in effect now, as of October 1st of 2015. One of the new things that all certified providers need to do and must do when they become certified is connect with their local county board to let the local county board know, I'm a new provider, I have my certification, I'm interested in working in your county. When that happens, they contact us, we link the new providers up with one staff person that we have dedicated in the SSA department to work with all providers to get set up in Stark County on a list where individuals have the ability to go to and choose the providers who are interested in working in Stark County. And basically, we'll get to that a little bit more. But after their initial service certification, and when a new provider contacts us, we help them plug in to Stark County. What this means is they come in and have a face-to-face meeting and they get an orientation packet. We go over rules and regulations of the services they're certified and are interested in delivering, that we explain the provider portal, which I'll explain in a minute. We explain how we do things in Stark County. Basically, the waiver program, is administered pretty much the same way in all 88 counties. We follow the rules that are the same because they come from the state and are filtered down to the county boards. Every county operates a little bit differently depending on the size and capacity and number of people served. Stark is a larger county. We serve 3,300 people at least right now, and that number continues to grow every month because we take new enrollments every single month. So that's total people served. On the waiver we serve about 1,200, and that number is also growing. Right now, this year, we serve around 1,200 people. So we have the provider come in and connect with one of our SSAs. Her name is Stacy Markin. She is our provider relations provider SSA. She works with providers to get them set up in the free choice of provider portal. She, of course, as I said, she gets them set up in the portal, which is an electronic website where providers can submit a profile about their agency or their services if they're an independent, all the contact information, all the delivery information, everything a provider wants to let anybody out there in the market know about them. we will include in their profile on the portal. Most importantly, name, contact information, etc., and all the services that they're interested in providing. Now, we of course won't do any of this unless we have proof that they are certified, which providers bring to us. We encourage them to participate in monthly provider meetings. We have meetings once a month in North Canton, and we provide information, education to providers every month on a different topic. Last month was on employment first. This month, our superintendent, Bill Green, will be coming to talk about updates in the field, updates in Stark County, waiver and Medicaid updates, and I'll be reviewing a little bit of this topic of provider certification. But every month, we have a different topic that's pertinent to what's going on right now in the field. Okay, we encourage participation every year in the provider fair. Our provider fair this year will be November 15th. It's coming up in about a month from now. We've had it every year in the fall for how many years, Lisa? A long time, haven't we?
Yeah, I
Yeah,
think
okay.
it's at least 5.
Right, and the provider meetings we've had monthly have been going on for a really long time. I've worked for different providers in the past. I've come to provider meetings years ago. They're very informative and they're very helpful to any provider that's interested in coming. We encourage attendance at monthly board meetings of our providers so they hear what's going on within the county board and they can assist in any way. You know, we want them to know how things are going here to help them build their business. All right, we facilitate information exchanges between DODD and providers. Anytime the State Department gives us any new information that's directly related to providers or even indirectly, I forward it on. I'm the person that all filters into and then I send it out to providers. We also encourage community connections with the ARC, with ASPE, and any other volunteer opportunities. We have the Great Pumpkin Race.
It's what?
The Great Pumpkin Race is
It's
this year?
Halloween, 31st.
Halloween,
Yeah.
okay.
Board meeting is this Saturday morning
Okay,
at
right.
10:30 in this room, and the Great Pumpkin Race is the 31st.
Okay, but to give you an example, that event, the Great Pumpkin Race, we send out a mass mailing to providers encouraging providers. Obviously, we send it to families and you know all over the community. Every community in Stark County, we encourage to participate in that and other types of events. And we strongly encourage our providers because certainly we're trying to develop a sense of community with everyone. All right, the actual role. These are the specific requirements to become an agency provider. They're not loose requirements. I mean, they're requirements that you would think, okay, if an agency is operating and employing staff, I'm going to care for my son or daughter, what would I want that CEO to know? And what would I want the staff who are going to work with my 3-year-old child or 22-year-old adult or 47-year-old son? These are the specific requirements, and this is again for an agency. Obviously, ID must be 21 or over, a certificate from the Secretary of State confirming that the agency actually exists. That sounds funny, but it has happened, where agencies really didn't exist as an agency. A person has applied for an agency in the past, didn't show proof of a vendor license, and they really didn't have an agency. It was one person who said they were going to become an agency and became certified. That can't happen anymore. They have to have an ID with the IRS that's an agency ID, not their personal social security number. An ID with BWC is the Bureau of Workers' Compensation. They have to have an ID number so they have a file, an account. Obviously, a bachelor's degree. You wouldn't want somebody in an agency, operating an agency, employing staff, managing staff, and training staff and these specialized services if they didn't have a degree in a related field or 4 years experience. Comprehensive liability insurance, they now have to show proof of that. They never had to do that before. 1 year supervisory experience to be the CEO. They have to have written policies and procedures addressing those topics. If you can see person-centered planning, Didn't have to have that topic before. Confidentiality, management of funds, measurement of satisfaction, internal monitoring of services, and staff training plan. That's new too. Didn't used to have a lot of these types of structural policies and procedures within the agency before they got their certification. They must complete 8 hours training course that covers the agency's roles and responsibilities in managing funds, individual rights, health and welfare alerts, and MUI. Some of these topics are new. Internal system to ensure compliance with certification standards, background checks, et cetera, et cetera. Just to let you know, the agency standards have been raised a good bit, and thankfully so. Some of us in the field are kind of happy about this, and I think some of the other agencies who have been operating up to snuff for many years are very happy about this too. Obviously, background check, CPR, first aid, that was iffy. For some services you needed it, some services you didn't. Sometimes you needed CPR, sometimes you needed first aid. First aid, now you need it for everything. And required to use RAPBAC. RAPBAC, R-A-P-B-A-C-K, is a whole new system that the state is adopting for all agencies that have to do any kind of legal check on employees, where background checks and criminal records and things like that are all going to be loaded into this one system, so it's much easier to track. You enter the new staff person's name into RAPBAC, and it will feed back if they have a criminal record, et cetera. Because one of the things we have to make sure is no one hired in this field has any type of record that's at the level of felony, and there's a whole list of types of crimes that if they've been arrested or indicted of, they cannot serve our folks. And thankfully for all of you, that's much more secure than it used to be. All right, these are the requirements for an independent or direct service staff. Remember, the last was agency providers for CEO. This is not as extensive, of course, because these people, these types of employees, independent providers or direct service staff, aren't running the agency. They're doing the day-to-day, so they'll need, obviously, a high school diploma or a GED, I believe is still accepted. They must be 18. They must be able to read and write and understand English. And you have to be able to prove that, actually, in an audit, in a compliance review. Now, one place where there's some understanding and exception to reading and writing and understanding English would be if an individual speaks another language and you have a staff person that speaks and writes another language that is the same as the individual's primary language. Maybe they speak Spanish fluently and English, or another language. If the staff person speaks that and writes it, that's fine. We would probably still need it translated so an auditor would be able to read it. However, that would be a great advantage. It doesn't happen very often, but anyway, they also have to have 8 hours training in those listed courses, completion of an online orientation. This is new for all independent providers and direct service staff. They must complete an online orientation that's on the department's website, 20-minute orientation before they can go any further. Before they can get any more training, before they can go any further in the process of becoming a certified staff person or independent provider, they must do the orientation online first. The course covers an overview of waivers, provider certification process. FCOP means free choice of provider. That's what I was talking about earlier, where I said we have a dedicated staff person, Stacy, who works with all providers to get them set up in our electronic portal so they can be accessible for individuals to view, and then they can post or respond to referrals. Health and safety, ISP development and implementation, payment authorization and billing, which is a big part of the department that I oversee, and documentation and compliance, background checks, etc. After beginning services with the individual, the provider, an independent or direct service staff, must complete training by the department on documentation and billing requirements. This is another piece that's absolutely required and now is part of a certification review. All providers must have evidence of showing some kind of training on how to document, what the required elements are, and that they're documenting properly based upon the service they're delivering, and they have to have some type of training on billing. They don't necessarily have to do their own billing. They can contract out for that service, but they have to have evidence that they've been trained and understand that they have to bill for their services in order to get paid. And they bill to the department, not the county board, not the family member, not anybody else. That's all their responsibility as a provider. There are fees with the initial application and then upon renewal or recertification. It's a little bit less, obviously, for an independent provider. And for agencies, the cost is tiered based upon how many people they serve. As you can see, for your initial application or your renewal for an independent, it's $125. Small agencies is $800, and a large agency is $1,600. Now, the last column where it says adding a service, if a provider is certified today for homemaker personal care and homemaker personal care transportation, that's all they've wanted to do for 5 years, then all of a sudden they decide, I think I'd like to transport people to and from their work site and be able to bill for that service. That service is a new service. It's called non-medical transportation. And if they wanted to add that service to their already resume of what they're approved for, they'll have to fill out a shortened application and pay an additional fee. And the same thing's true for providers. And providers can add services or apply to add services at any time during their certification period. They would just have to follow, obviously, the instructions and provide any supporting documentation that's required. All right, all applicants submit an application along with the verification of meeting all their requirements to the department online through a certification wizard. The whole application process is online. A provider must submit supporting documentation for different pieces and parts of the application, which they must upload. The state does not take these applications faxed, they don't take them mailed. Everything's done through this online portal called the Provider Certification Wizard. Once submitted in complete form, if a provider submits everything they need to, the department, DODD, has 30 days to respond to them to approve or deny that application. If any of you have been involved with obtaining a new provider and it's been very, very lengthy, the reason for the delay typically is the provider forgets to send something. They forget a piece of documentation. Because one of the good things about online application is it's sent directly to the same place and it's electronic and it can't be missed. So if, say for example, you're a provider and you've submitted through an email or uploaded it, you should have record of that. When it gets, there's no more, it got lost in the mail, oh, we didn't get it off the fax, et cetera, et cetera. After your certification is complete, and active providers maintain connection with DODD and start DD through the following means. Certification renewal is every 3 years. So when they're rubber stamped and they're certified for whatever services they've applied for, that certification only lasts 3 years and then they have to renew it. Provider compliance, which is the auditing process, is every 3 years. Those 3-year cycles don't necessarily jive. A QA-RN review is every 3 years. That's a review of medication administration for any individual that has paid provider staff administering their medications. That paid staff has to go through a specialized program to be permitted to be a non-licensed professional and administer meds. So those staff that administer meds have to be reviewed every 3 years. SSA involvement. We monitor, monitoring is a service review. Now, and we're talking about both providers and individuals, more so individuals. We keep in touch with providers through our folks, through the folks we serve. Now, providers contact our department all the time. because my department does the payment authorization, which is the money. So providers are always in contact with us. We calculate the costs of the services, and then we upload the costs into the system from which the providers bill from. If providers have any billing problems, they come to us. We can look in the system, they can send us their error reports, we can help them out and figure out why they didn't get paid. That's part of, whoops, I'm sorry, there we go. Annual monitoring, I believe that just means through the ISP review process, every individual's ISP is reviewed once a year at least. SSAs are monitoring their individuals based upon the need of the person served and based upon what needs that individual has and what progress they're making and what cool stuff they wanted to do. As Josh was saying, how can we make this happen? Those are the kind of things we're paying attention to now. What's the step-by-step process to make things happen that we never even thought about before? Because we know the providers are going out there, that all the kind of routine stuff we keep an eye on, but we're keeping a closer eye on what's new and exciting and how are we making sure that's continuing to happen. As I said, we keep ongoing contact with our providers through our individuals, through our families, and then directly. Special compliance reviews. These are audits that we can request if we see a number of issues on the part of a provider. If we start gathering some information and one piece of information leads to another and we have some great concerns about a provider, we can request a special compliance review from the department to come out and review that provider, audit what they're doing to make sure they're meeting standards. Or we may come across evidence that shows us they're not meeting the standards. We need to have them reviewed. And then those reviews are requested by our department and completed as needed. Provider meetings, trainings, as we said, provider meetings are monthly. If we have any additional specialized training, we offer that, but I don't believe we've done that for a while. When we have topics that we really want our providers to be trained well on, we bring it to the provider meetings and we share with them. And that's about it. Any other questions about this exciting? Yes. Topic?
Here, Candy.
I'm going to give my personal opinion. High school education only is not good enough for me for taking care of our special needs. Children, individuals, adults, whatever. And I did go over to Rescare, which is just across the street. I toured it, and I did speak to somebody who did work there, and he said I only had to have a 2-week training, and he had left. And the person who just left, she wanted me to say the independent direct care, they have no training, no background experience with special needs. And you talk a lot about the certification, but it's the training. We have professional staff here at the workshops. They have college education, they're certified, and they do not, I'm sorry, I don't feel they're qualified.
I understand exactly what you're saying. Now, keep in mind, these are certification standards that have increased in some areas just effective October 1st. We at the county board and local level don't set those standards. As I said, the State Department of Developmental Disabilities, Ohio Department of Developmental Disabilities sets the standards. I would encourage you to talk to your representatives. There's no reason why a family member can't contact the State Department to tell them how they feel. Okay. And you should. You should never hold, you should contact the State Department. Let them know. Because again, when they develop rules and they upgrade rules and they make changes, they do that over a series of time with a series of meetings that includes family members. It may not have included you and your opinions, but they include family members from across the state, in addition to their own staff. And they try to include individuals who receive services. That's very, very important for our State Department over the last couple of years and moving forward, that individuals who receive services who are outspoken or who can be outspoken are part of the development and change process.
Over here.
Okay.
Go
Go ahead.
I'll get around with my.
All right.
Yes, my name is Joyce Solomon, and I run an agency. I ran one for 10 years here. What I would like to see, if you have a list of the providers, and you have a list of some of the services that they do provide?
I have,
You can find that on
yeah,
the
you
department's
can do that on
website.
the
For
department's
Stark
website.
County?
Yes.
Yes, you can search for any county. If you go to the
Okay.
provider search, hit the provider search button. If you go to the homepage for the department, up in the left-hand corner is a provider search button. Click that button. It opens up a new page and portal. That's the provider search portal. You can enter whatever you want and be as specific or as broad as you want to search for providers across the state of Ohio.
So do you, one more question, because I know you're going to say, so do you provide, like what you're doing right here, right now, would you be willing to go out to other agencies such as mine and pass this information on? And also, I would like a card from you
Uh-huh.
before I leave.
I have a card. I
Okay,
have
thank
cards
you.
I can give you.
You mean about provider certification?
No. If you could come out into some other agency, you know, like mine, whatever.
We would be happy to. We would
Yeah,
be happy
thank
to.
you.
And I think that that's a part of,
Because I wish you got, see, we can get out in the community more, because how I found out about it through this young lady right here that works at the library. So when I came in to do some work at the library, then Miss Kim gave me this information. It's not being funneled enough out in the community. It's like certain groups are getting this information, and certain groups aren't. So I know you guys want everyone to get this information. So we would appreciate that.
we do it, this is actually only our second family information series, so, you know, we continue to want your input, so please keep coming and give us your input. The more input we get, the more we can improve, and that's what our goal is every single day, so we certainly appreciate it.
Thank you.
If you are a provider in this room, please come to the monthly provider meetings. And stay after and give me your contact information, because if I don't have your up-to-date contact information for email, you're not gonna know about what the topics are and what we're doing each month. Because I send an email blast out to all providers every month, reminding them of the provider meeting, what the topic is. Yes, Debs.
Hi, I'm Debs Schumard. I'm an agency director. I've been an agency director for the last 15 years, and I'm also a guardian for my brother who has autism. I've been his guardian for 32 years. And I run a training agency that offers training for providers. So I wanted to make just a couple of quick comments. I understand as family members, you're really going to want to get the best for your loved one. And probably the most important thing is that these standards are being raised, and that there's a lot more going on now coming from DODD to draw better people into the field, and to draw those people into the field who will be able to care for your loved ones in the best way possible. But with all due respect, they're not always going to have a college education. We have a group home manager who has a high school education, and she is 30 years old, and she's phenomenal. And my brother spent most of his life in a developmental center, and he now lives in a community home successfully because of this person's competence. So I just, wanted to make that observation clear to you and everything, and ask as many questions as you can when you're looking for a provider, and make sure that you're comfortable with that agency or with that individual provider. Thank you.
Thank you, Deb. Anybody else? Yes.
Yeah.
Oh, I'm sorry. I'm sorry. She's coming around.
Yeah.
We'll get to you next.
I just wanted to say that I appreciated the call that we got. I don't know who did what, but we both got it. And if we hadn't, we wouldn't have known about this for whatever reason. But I just want to know that that worked. Thanks a lot.
Good.
That was me. We do.
Was you?
Yeah. I do put them in the newsletter if you're on social media. We send them home with individuals. I do the alert calling. But if you have another mechanism, and before you leave, if you have an email that you want to leave, and I will put you on an email distribution list and do an email blast. I will put a plug. I don't know if we've decided the date yet, but because these are important, I want to do another one in early December for the holidays, so after Thanksgiving. And so, before you leave, if you want to leave an email, I will do that. I think these meetings are important and these topics. So I'm trying to do my best and finding every tool I can, but I thank you so much. That was my voice.
Thank you. Hi, okay, I'm Sherry. My daughter's in high school, and I want to know why. I want to know why the parents of high school kids with special needs, they never hear of anything. I mean, she's going to be graduating this year, and my new employer, which happens to be his wife, she, told me the process of her getting an SSA and all this stuff. But us parents in high school, we have no clue of what's going on. The high school doesn't teach us, and unless we happen to find out something like this, that's the only way we get information. She goes to Lake High School.
Oh, it's in Lake.
Yeah.
Well, thank you for bringing that. Actually, right behind you is Jeremy Ballinger, who's one of our transition specialist SSAs. This is something that's extremely important to us, making sure that our local school districts know Jeremy and two of his coworkers, soon to be four, know about transition and know what services are available and how to get those services. And it's a newer position and something that we're really focusing on. It's so important that we reach out to you, your family, the teachers, the principals, the school districts, and that's certainly a big goal of ours. Right now, we have 3 transition specialists, Jerry Ballinger, Katrina Smith, and Lisa Boron, and in the new year, we're gonna get another. And the goal of them is to do just exactly what you just said. So we certainly realize that it's something we need to work on, but we have the resources in place and we have staff that are really, really working hard to make sure they're getting to your school district. So before you leave, you might wanna grab Jeremy, who's right behind you, and he can give you some information. But I think that over time, you will see an immense improvement in that. And even just in the time that I've been here, I've seen those 3 just working tirelessly at that exact goal. So we are definitely working at it. So I think we have right here.
I'd like to bring up that these young children that went through the program and the procedures to developing themselves to not be qualified in training, that when this program shuts down because of lack of funds and everything, will these children still have a place to progress in society? And the place all shuts down, all the providers and everything just vanish and everything, but will the people work so hard through the years to progress, to be able to not be retarded or slow learners, will they have an opportunity to work and have jobs and go on with life in society after their training has been all these years? Won't be just tossed aside, but will be for the developing of retardation and disability children will have an opportunity to complete in the world and following to live after everything's dropped down.
Remember that it's just the county board training centers that are consolidating and minimizing, which encourages and enhances and encourages growth with all the other providers. None of the other providers are going to shut down unless they choose to. That's the whole
But they
goal.
will have a program that will help mentally retarded.
Yes.
That they won't be just
Yes.
forgotten and thrown
No,
away.
absolutely
Yes.
not.
Because,
Yes.
like I say, all this work, we don't want it in vain.
Right.
We'd like to see progress of those children that had a hard time of making it through this world thing, because I remember back through the years of my age that they were cast into mental institutions, national state hospitals, and everything, because they couldn't keep up with the people that had education. And these that had no education were just cast aside as something that didn't mean nothing.
That's not happening now.
And-
And that's our goal, that's what we're all here for, is to make sure that doesn't happen.
Well, that's
It's
what I
a
hope.
really strong responsibility of us in SSA.
And that's our
fair,
commitment.
so If they're having a chicken, it's homemade.
You're absolutely right, and you bring up good points that I think many people here are asking about, and I think you asked about earlier. So thank you for letting us wait until Mary Lou and I can answer your questions, so that we make sure that the right staff is answering, the right question for you. It's so important. Yes, we are committed to you, and we will continue to be committed to you and to our families and the individuals that we have the honor and privilege to serve. That's so important to us. And you had asked a little bit about the consolidation, and as Mary Lou said, that really has to do with the Centers for Medicaid and Medicare Services, CMS, okay? Waivers are actually, that's where the funding is coming through. That's not actually something that's within our control at the county board level. That's coming federal government, basically. And it's basically saying that you cannot write the plan, you can't write the service plan, and also be the provider. Meaning you can't write a plan for somebody that says, here's your plan, and I'm also gonna be your provider. And that's a newer perspective for us, right? And that's difficult because, we've always done a good job statewide, and we've always been committed. And we never wanna go back to the days that you are referring to, and that is our commitment to you. It means things changing, but at the same time, it means we need to have a renewed focus on the individuals and families that we serve. And it means we need to keep in constant communication and pull together as this Stark DD family that we are, because things are changing. And we need to communicate with each other about it. And it's scary, right? It is scary. We're all scared. And I think that's okay. But I think the more important thing is that we all come together and that we realize that, this is something that we have to follow because of the federal government, but we're gonna work together and do it, and the number one priority is the health and the safety and the happiness of the people that we serve, right? We cannot take our focus off of that. And so we will continue to strive for that, but this is what we need right here. People coming together to talk, informing each other, and us continuing to all work together. So we certainly appreciate you all coming and sharing your questions and your thoughts.
Thank you for having this program. Thank you for what is a really hard process for families. I'm grateful that you are person-centered, and I really look forward to this tool, the center. I think that's a great tool to kind of stretch, so families, specifically the individual, really gets to, prioritize what's important to them. I would echo the high school. This was a, frustration in our household and some of the students that, we peered with. And I don't think it's a failure on your side. I do realize that the teachers have a lot on their plate and prioritizing and then, helping with that transition. So I appreciate all the effort that you're making to try and communicate that. I don't think it's anything of a failure on your part. I think it's probably, some part of the school. So whatever you can do to reach out. But the question I had is the provider list, is that a state run or is that a county run list? And is it updated locally or?
Yeah, we're actually talking about two different lists when it kind of comes back to the question that you asked. I'm going to move over a little bit because I think it's squeaking because I'm over there. When we're talking about being able to look up all the providers in Ohio or all the providers in Stark County, you can actually go to the DODD website. If you just type in DODD in your Google search engine, it will come up and you can click on the top left-hand corner. It says provider search. That will let you search any provider in Ohio, but you can also minimize that search and just click Stark County and see all the providers within Stark County. And yes, that is updated by the State Department, and it is kept up to date pretty well. It most definitely is. The only thing we sometimes hear is that there may be a provider on there that only serves one person and doesn't serve other individuals, and so sometimes people are like, well, I call that provider and they don't want to serve, but it's literally all the providers within your county. Separate of that is what Mary Lou was talking about, which is the free choice of provider portal.
And that is unique to Star DD. That is run through iData, which is a software company, and they basically have a provider portal that's fully confidential, where an individual can say, I want such and such services, they can give us some information, and we can basically allow providers to look at that without knowing the person, just knowing this is what I need, 2 hours per week, help in the home while my mom's at work. And then providers are then able to say whether they can do that or not. And it is a way for us to ensure people have the freedom to choose from able and willing providers. It's a system that is really renowned statewide. There's only a couple of counties in the state that are using it. And it's been very beneficial to us. And it is kept up to date really, really regularly. And then as a part of that process, as Mary Lou mentioned, we have a specific staff person, Stacy Markham, that she will help families through the provider search process. She often attends interviews with families or individuals, or maybe if they don't want her there, they can do it on their own privately. But we do have a lot of resources that we're very proud of, because not all counties in Ohio have those. And those are specific to being able to help individuals and families pick a provider and kind of give them information about that provider that they might not be able to fully find on their own.
My question is, you said a lot of those, the criteria for the providers has changed as of October 1. How long do they have to be compliant?
That I'm not sure. The new certification standards go into effect October 1st and only apply to those applying for service October 1st or later, and then upon renewal. So, say you're a provider certified right now, whether you're an agency or an independent, or you were before October 1st, already had your certification for this set of services. You as that certified provider don't have to meet these new requirements until your next renewal. But if you were not a certified provider and you submitted your application from October 1st or later of this year, you have to meet all the new criteria.
So they're going to follow you.
Basically,
Okay.
But then they'll have to have
but then
it
they'll
on
have to
their
have it upon their next 3-year renewal. I'm sorry, their next renewal. Yes.
In regards to independent providers, so do we know if the employer authority thing is happening January 1?
No, I haven't heard any definitively, and I doubt if it's happening January 1, if we haven't heard anything about it.
Okay.
Although I shouldn't say that, because it's, it's available through the self-waiver. I hope it doesn't happen January 1, but,
I doubt that it will, but when we find out, we'll certainly let you know.
We will certainly
Okay,
fill
thanks.
everybody in. Sometimes we find out very last minute of state decisions, but definitely, we'll send that out.
Did
Keep
anyone
an eye.
have any
One
other
thing
questions?
I want to add, keep an eye on the department's website, dodd.ohio.gov. Check it at least once a month if you're just a family member. If you're a provider, check it frequently. If you're not getting notifications, if you're a provider in the room and you're not getting notifications by email, but you're hearing other people who are providers, or you're hearing us telling you things for the first time today, make sure you get your contact information updated through the Department of Developmental Disabilities, or you're not going to get information. Every provider is responsible for keeping their own information updated with the state. When you tell us, we'll fix it in our local portal, but we don't communicate that to the Department of Developmental Disabilities.
One quick reminder, the provider fair, November 15th from noon to 5 o'clock at Walsh University in the Barrett Center. On a Sunday afternoon, it's very accessible, close parking, very good event. Again, I know that we've had it at least 5 years. There will be a couple breakout sessions, and then in the main room, there's all kinds of providers that you can walk around, talk to, grab business cards, and just find out some more things. So it's a very, very worthwhile event.
Hi, my name is Joy. Do
Do you know what the topics will be?
Oh, do we know what the topics will be, Mary Lou?
Oh, yeah. One of the speakers who's come the last several years, Gary Tonks, who's the director of the ARC from the state of Ohio, he'll be coming back to give pretty much the same topic he gives every year. He talks about the waivers and the status of waivers currently at that point in time. So he'll talk about what are waivers now and what they mean to your children, what they could mean to your children if you don't have a family member enrolled. Maybe he goes over basically the whole process in a nutshell from a family's point of view. And then our second person, we're still kind of in the works. I had somebody in mind, but we didn't get a confirmation, so that's still to be determined. What we're hoping is to get somebody to come out and talk to providers about how to review the ISP and analyze it to transfer what's in the ISP to their doc sheets. Because our whole ISP process is much different than it used to be. And it's a little difficult, sometimes a lot difficult for providers to figure out, what do I take from here and put it on my documentation sheet so I'm documenting in accordance with all the compliance standards. So, anyway.
Are there any other questions? If not, we're gonna leave on a positive note and let you show our video that we really wanted to show you. So, if it doesn't work, I'm just gonna have to sing for you, okay?
Okay, and then if you want to leave your email to get on that email list, you can see Emily, and she will have paper that you can add your email list to, okay? This is 3.5 minutes.
Supervisor, and I love to do activities and this program. I'm a volunteer, and I love to live in the mail and help people out at the courthouse.
I'm a self-advocate, and I'm joining at Jim to gain strength.
I just returned from California where I participated in the World Games.
I am your neighbor, I live in my own home, I have a dog, I do everything with it, and I love it.
Quality, treat equal, I'm just like you.
Those that support us focus on our wants and our needs, our future.
Don't give my ability to anything.
Helping me build connections and relationships so I can be active in my community. I want to contribute to the world around me.
Thank you, everybody, for coming, and we say thank you so much for staying past the 6 o'clock. Okay? I will. Thank you so much, dear. Email?
See, I hope that wasn't too embarrassing.
No, that was great.
Oh, no, you did good talking. Since you guys were here, we just have to do it. That's